Hi Ange, how are you going?
Good, thanks.
My name's Stacey, nice to meet you.
You too.
So before we get onto your exercise program, I'm just going to ask you a few questions. Your date of birth?
The 6th of the 6th, 1995.
Alright, has your doctor ever told you you had a heart condition?
No.
Do you ever experience unexplained pains in the chest during physical activity?
Nope.
Do you feel faint or have dizzy spells or anything during physical activity?
No.
Have you had an asthma attack in the last 12 months?
Never.
Diabetes at all?
Nope.
Alright. Do you have any have you been diagnosed with muscle pain or joint pain in the last 12 months?
Nope.
No? Do you have any other medical conditions that you need to tell me about?
No.
All good. Alright, so before I get onto the next page, I'll just get you to sign down the bottom there. Thank you. So your age would make you 19. Do you have a family history of heart disease at all?
No.
Do you smoke?
Nope.
Well done. Alright, so can you just explain to me your current physical activity at the moment? So what do you do?
So I do yoga twice a week
Yoga twice.
and bike riding once a week-ish.
So probably about 4 hours a week of physical activity?
Yeah.
Have you ever been told you have high blood pressure?
Nope.
High cholesterol?
Nope.
Or high blood sugar?
No.
No. Have you spent time in the hospital in the last 12 months?
Nope.
Are you taking any prescribed medication?
No.
Pregnant?
No.
And do you have any muscle pain or soreness that can be made worse with physical activity? No. Okay, well done. So just a few more personal questions about yourself. I'm just going to ask you a short-term and a long-term goal. So do you have any goals in mind?
So I want to be able to do about 10 push-ups without getting tired.
10 push-ups. So that can be a short-term goal.
Mm-hmm.
A long-term goal, something like, do you like running at all?
Yeah. Run about 5K.
You want to be able to run 5Ks?
Yeah.
Long term. So, your current activities that you're doing is yoga and bike riding. Is that right?
Yep.
So, what do you do on a day-to-day basis? So, your work is,
Just sitting down all day.
so you're at an office?
Yeah.
Do you have any preference with exercise? Would you prefer to work out outside or inside?
Outside.
Outside? Okay, so what days are you available to do exercise?
Tuesday, Thursday, Fridays, and weekends.
And afternoons?
Yes.
Is that right? Friday afternoon. Oh, that's good. You have plenty of time to exercise. And weekends. Okay, great. So I've got all that information. So what we're going to do now is we're going to get some measurements. So first of all, I'll get your height. Yep. So if you want to come over to the wall. What I'm going to do is get you to just step onto that. Maybe at 154. So I'm going to grab your weight as well. I'll just grab the scales. So do you mind taking your shoes off for me? Thank you. So I'll get you to just pop on the scales. Alright. So 45. Well done. Alright. So what I'm going to do next is I'm going to grab some measurements. The first one I'm going to grab is your chest. So I'll just get you to face that way. Arms just outwards. Going to grab your waist, so arms out again. Same thing again, I'm going to do your hips. Okay, the next one I'm going to do is your thighs. So I'll start with your right thigh first. Do the right thigh now. Left, sorry. That's normal. And now we're just going to do your upper arm. So we'll do the left. Right. 24. So we're done with those ones. So the next one I'm going to do is I'm going to use these on you. They can be a little bit ticklish. But so what I'll do is I just grab a piece of your skin, clamp it, and it'll take like 2 seconds. Alright, so we're going to do the bicep first. So nice. And I'm just going to do the back of the arm, so the tricep. Oh. And I'm going to do the scapula, so it's just the subscapula, so it's just the back. So I'm just going to grab a piece of skin here. Thank you. So the next one I'm going to do is your stomach. So do you mind just lifting your top up for me? Thank you. So I'm just going to grab a piece of skin here. Okay, well done, Ange. So I'm just going to take those calculations and then we can get started onto your program.
Awesome.
Thank you for your time.